All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news every Tuesday and Thursday on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions that we've received through today, the 19th of October. And we invite you to continue to submit those questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is the Institute's Student Research Assistant, Sophie Biskowski. So Sophie, I turn it over to you.
Thank you. Hi, Dr. Murphy.
Good morning.
So for some updated statistics, right now we have 57.2% of the United States population fully vaccinated. And fortunately, we're seeing a decrease in cases. Yesterday, there's a 7-day average of 83,000 cases, which is now under 90,000. There's also been a 22% decline in the last 14 days. While many and the majority of states in the United States are decreasing in cases, we have seen a spike in Minnesota, Colorado, and Vermont with some 30% increase in cases over the last 7 days. In Illinois, there's 54.4% of the population fully vaccinated, and we are currently seeing a really nice decrease, and we are now under 2,300 positive cases per day for an average. What can you tell us about some of these headlines, but why are there a couple of states that are increasing in cases right now?
Well, we're a big country, geographically very big, 333 million people. And so the pandemic is different in different areas and in different populations. So it's not really uniform. And so nobody should be surprised that you see some waves up in Minnesota and Vermont even, an island in the Pacific, Guam, it's really kind of all over the place. The big populous states like Florida and Texas, they had their peak early in this whole thing because they, really don't believe in the mitigation strategy as much as other states. And so, so they peaked early and so they came down earlier. California put in really strict mitigation rules and vaccine mandates, and they came down as well. They were not doing very well just a few weeks ago, over a month ago. Anyhow, so nobody should be surprised that this is the pattern. Overall, things are going in the right direction, but you're going to have these little bumps. In Illinois, 2,265 cases. That's a lot. It should be in the low hundreds. To really feel comfortable that this thing is under control. With thousands of cases per day, it's really almost impossible you can't track these people. It has to get down into the hundreds to really get some kind of control over things. So that's just the way this goes. It's going in the right direction, but there's still way too much COVID floating around out there.
Right. And speaking of the wrong direction, for some headlines, the Chicago police is issuing warning to officers on consequences of disobeying vaccine policies. What can you tell us about what's going on with the Chicago police and COVID?
Well, they're fighting the mandate. It's a political maneuver, has nothing to do with public health. Matter of fact, they're putting themselves at risk. More policemen have died of COVID than being shot on duty. I don't understand what the problem is. These people, these servants of the population, they are putting themselves and the people they come in contact with at risk. So it's a very high risk thing. I think the mandate for all the city workers and state workers, I think, is a good idea. We do it in the hospital because we're also at risk. They're at risk. They're with the public. I really don't think this should be a political thing, and it should just be, if you want to work with the public, you've got to be vaccinated. Otherwise, you're just spreading this infection even more. So I think hopefully things will turn around, and if we can just put the politics aside until we get this thing under control, the best thing is just, unfortunately, for everyone, regardless of what you're thinking, it has to be vaccinated. Otherwise, this thing is not going away.
No, absolutely. And with the holidays around the corner, we're about a month from Thanksgiving. What can you tell us about how to safely celebrate COVID, and what has the CDC said about these mitigations?
Yeah, so CDC has issued some guidance here. Basically, it's what we've been saying all along. From their website now, their guidance says, protect those not yet eligible for vaccination, which is children under 12, by getting yourself and everybody around the children vaccinated. So they found that in families where everybody's vaccinated but the kids, they do okay. And it's safe, and you're not really spreading the infection that much. If you're in a public indoor setting and you're not fully vaccinated, and even people who are fully vaccinated, it's probably a good idea to wear a mask. Outdoors is safer than indoors, but we're in the fall and this is only going to get worse. So we're all going to be indoors pretty soon. Also avoid crowded, poorly ventilated spaces. And if you're at all sick, any kind of sniffles or anything like that, don't go out or attend any gathering. You don't know what you have. And if you have any kind of symptoms like that, get tested, even whether a rapid test or a PCR, whatever you can get your hands on. So it's basically the common sense we've been talking about all along.
Right. And now for some viewer questions. What is the rate of breakthrough infections that we're seeing?
Yeah, the breakthrough infection rate, although we hear a lot about them, there's not that many. The estimates are that 1 in 5,000 people who are vaccinated are getting a breakthrough infection. So 1 in 5,000. But there's a lot of 5,000s in the hundreds of millions of people that have had the vaccine. So the number goes up. But keep in mind, it's a lot higher if you're unvaccinated, and a lot higher if you end up in the hospital. If you look at all the hospitalizations, all the COVID hospitalizations in the United States, which is tracked, only 3% of those are people who are vaccinated. So, the burden to the healthcare system is in the unvaccinated people. I mean, the story with Colin Powell, very unfortunate, but he was 84 years old. He had underlying multiple myeloma, which is an immunocompromising condition. He was very high risk, and it's a tragedy, that he got COVID and died of COVID. You can certainly die of COVID if you're vaccinated, but it's mostly older people with underlying disease, just like Colin Powell. It's very unfortunate. It doesn't mean the vaccine doesn't work. It also highlights the need, especially in this kind of population, for the booster shots as soon as possible. Now, if you have an underlying disease like multiple myeloma, which is the second most common of those kind of tumors, cancers, you're eligible under the first EUA to get a third shot. You don't even have to wait 6 months.
Wow.
You can even get the Moderna or the Pfizer.
Wow.
Yeah. So that apparently was not the case with Colin Powell. He was waiting for the regular booster. He didn't really actually have to wait. He could have had the booster beforehand. So there's so much confusion with the messaging here about when you get the booster. If you have an immune compromising condition, you can get the third shot. You don't have to wait 6 months.
Awesome. And now with more breakthrough questions, what is the breakthrough infection rate at 4, 6, 9 months post-infection?
Well, we talked about how kind of uncommon it is. And so that number is pretty stable. What they showed in one study was that the antibody levels in the Pfizer vaccine in particular start to decrease at 4 months, and the hospitalization rate starts to increase slightly, but it looks real. So it's all kind of relative, and that's why the booster recommendation is at 6 months. Now, the death rate from COVID did not change, but the hospitalization rate, people got sicker starting at 4 months. The Moderna held up better, but also starting to drift down, and so that's why the Moderna boosters were approved as well.
Right. And now for the last breakthrough question. Also, are there increased rates of breakthrough infections in certain groups of people, like the elderly or immunocompromised individuals?
Oh, absolutely. Yeah, it is immunocompromised and over 65 have a higher rate. And so we want to protect those people first. And they are listed number 1 on the on the booster eligibility list over 65, and then anybody even under 65 with any immunocompromising condition or any essential worker who's in contact with people who might be infected.
Right. Now for a rather unfortunate situation, this individual had COVID last November, almost a year from now, and have lost their sense of smell and taste. They have not gained it back. Instead, many of the smells have a rancid smell of almost most things, and nothing tastes like it should. For example, coffee, chocolate, peanut butter are just a few items that taste and smell awful. What can this individual do to help their sense of taste, and will this change over time?
Well, this is a tough problem. Usually the smell does come back after a period of months, but this is going on, for almost a year now in this person. I wouldn't give up, but I would seek the advice of a neurologist who's experienced in treating some of these COVID symptoms. There have been some approaches that have been taken, kind of behavioral approaches, basically teaching people how to smell again, because the brain can just forget how to smell. And so they've tried, positive feedback, looking at the food or a picture of something, and then introducing the smell again. And it's a complicated thing, and that's not going to work in everybody. But I mean, there are some attempts being made in that particular area. But I would seek the advice of a neurologist or some clinic, a neurology clinic that is looking at long COVID cases.
Absolutely. And now this individual is a fully vaccinated person who tested positive for COVID a week ago from today. Their first symptom started last Saturday. Their question is, how long should they wait until they get their flu vaccine?
Well, they should just wait until they feel better, in at least probably 14 days that's basically the whole course of COVID. So no magic really, just get over the disease. You wait at least 14 days and you can go ahead and get any vaccine you want.
Wonderful. Now, this individual's 90-year-old parents tested positive for COVID on September 25th. Both have been quarantining at home since the positive test. Their mother doesn't have any symptoms and their dad is tired, but neither of them have a fever. They had another PCR performed yesterday, so this is after 14 days of quarantine, Saturday, October 16th. The results were again positive. Are they still contagious? Should they quarantine? What should some of these next steps be for them re-entering into the world?
So doing the PCR test is not very helpful after you're diagnosed. It's great to make the diagnosis, but to follow a person, it can test positive, and it doesn't mean you're infectious. It just means there's pieces of the virus there that are testing positive. So these people, just the guideline says, you wait the 14 days and then as long as you're feeling well, you can come out of quarantine. Now, if the father still has a fever at 14 days, he needs to wait longer. So his symptoms have to completely go away and be at least 14 days, and then they can come out of quarantine.
Awesome.
But the PCR test is not a good test for follow-up.
Right. And for our last question, in another COVID case, if they've received 2 vaccines and they got infected with COVID last week, should they get the booster when it's available?
Yeah, absolutely. COVID is kind of like a booster, but then they should get a regular booster when they're eligible at 6 months. If they are eligible, sounds like they are, but they should have the booster as well.
Awesome.
Matter of fact, these people are called hybrid patients because they have COVID sort of acting like a vaccine and giving some immunity, and then the vaccine afterwards. They actually have a bigger response.
Wonderful. Well, thank you, Dr. Murphy. Those are all of our questions from today.
Great. Thank you.